from Professor Peter Jones from Department of Psychiatry. So Peter leads ARC, and Elspeth mentioned dementia. You might think like, why would you have dementia in children's hospitals? But actually, what we want to be able to do is identify the origins of disease, and it's not entirely implausible that dementia and other chronic diseases of adults start in children. So ARC is thinking broadly about life course, and I'm sure we'll hear some interesting ideas in Peter's short talk coming up. Over to you, Peter.
Thank you very much for that introduction, David, and for inviting me to take part in this. I've been here since lunchtime, and it's an absolutely fascinating set of discussions. So my talk follows on very nicely from Elspeth's, one of the colleagues in the Applied Research Collaboration East of England. And it seems entirely appropriate that a National Institutes of Health research infrastructure that covers the region, I hope can continue to develop a really good relationship with the Cambridge Children's Hospital, which is being developed for that region. So I'm going to give you a little bit of background context about what the ARC, or the Applied Research Collaboration, is. So this is a £9 million grant from National Institutes of Health Research that we have to match with on a one-to-one basis with co-funding from partner organisations. And we're about halfway through the current 5-year programme. And the most important word in the ARC is the collaboration. So this is some of the logos of a small proportion of the organisations that we collaborate with across the East of England. The key partners are at the bottom there, the 4 universities: Cambridge, UEA, Hertfordshire, and the University of Essex. The host trust is Cambridgeshire and Peterborough Foundation Trust, and we have an increasingly deep relationship with Eastern Academic Health Science Network, particularly to help us with implementation of spread and working with industry. We are involved in place-based research. We work particularly with 4 what we call populations in focus. And these are Great Yarmouth and Waveney over on the coastal rim, Peterborough and Fenland, Thurrock down here in Essex and the Thames Estuary, and in Stevenage, the UK's first post-war new town with a cohort of ageing migrant London overspill population. So we don't only work with these populations in focus, but we work particularly with them. And if we can do our applied research in these populations, then we will. And I think it'll be very interesting to think about, maybe use these populations as a barometer of the regional effectiveness of the Children's Hospital. So what does the ARC do? Well, it has 3 remits really, which come together into impact. So we do applied research, and NIHR defines that as research that will have an impact within 3 to 5 years. And we have a number of key research themes. The first one, led by Wendy, prevention and early detection in health and social care, mental health over the life course, Jesus Perez, leading on some of the themes that David mentioned in his introduction, thinking about life course approaches to mental health and well-being. Aging and multimorbidity, led by Claire Goodman, also from Hertfordshire. Palliative and end-of-life care, led from Cambridge by Stephen Barclay. You've heard about Elspeth and Fiona Poland's theme, inclusive involvement in research for practice-led health and social care. That's really working out how to do PPI better. And Elspeth gave you some lovely examples of that. Then health economics and prioritization in health and social care, currently led from UEA by Anam Wagner, and population evidence and data science led from Cambridge by Carol Brain. The second major remit is, excuse me, capacity building. And We do this by investing and planning part of our ARC funding and our partnership funds to increase capacity for applied health research, social care research and implementation. So we have a number of fellowship programs. There have been two predecessors of the ARC, and since 2011, we've had over 100 fellows from around the region that have worked with the ARC. And the fellows learn how to do applied research. They have a sort of apprenticeship program, a day release. We teach them an innovation program, and they have an action learning set. We've recently added year-long implementation fellowships, working particularly with the implementation leads in the ARC, Professors Gabay and Lemay, and now we'll be working with the Academic Health Science Network. We've just got increased funding for fellowships around mental health research and in social care. When we also fund some postgraduate degrees, mainly PhD studentships, sometimes master's courses. The third remit is PPI, involvement, inclusive involvement, working with these communities, trying to shift the balance of power in research and be guided by and increasingly work with citizens and communities. And Elspeth's given you some really nice examples of work, but we build this into our governance structure. We build it into our research projects. We have a coordination group across the ARC that works increasingly with the other NIHR investments in the region, like the Biomedical Research Centre, the Research Design Service, the Clinical Research Network. We're all beginning to align our forces in terms of public involvement. We work nationally as well with other ARCs, and I think one of the real strengths of the PPI work in the ARC is that we have Elspeth and Fiona Poland's research theme on how to do this better. So it's evidence-based patient and public involvement. So it's the applied research, the capacity building, and the patient and public involvement, which all help us have implementation and impact. So it's a coordinated approach to try and improve health outcomes and social outcomes within the whole region, but particularly in these four populations in focus. These are our communication channels. Some of you may be familiar with them. We'll be very keen to spread these. And I suppose the point of this introduction is really to begin a debate about how the links with the ARC that we've already been hearing about, some of them designed, some of them happen chance, how we can continue to work with Cambridge Children's Hospital and really make it have regional and also national impact. If we can take some of these ideas and turn them into research projects to increase, to improve children's health across the region and beyond. So thanks very much for listening.